I want to talk to you for a moment about healthcare. I'll try to be brief, informative, and clear. Let me start by taking you to the 2020 election, where healthcare was very much a topic in the presidential race between Bernie Sanders and Joseph Biden. In the debate, Bernie Sanders laid out his best case for universal coverage, and Joe Biden had this response. Joe Biden said that universal health care deprived the individual of having choice. He gave the example of a union that might have negotiated a contract with a health care insurer, and they might prefer to have that plan over being forced to have universal health care. It was a pivotal moment for the universal health care, and it was a pivotal moment for the Bernie Sanders campaign. Unfortunately, Bernie Sanders, who is someone I supported because of his advocacy for health care and other issues, responded with one of his famous canned answers. As you might recall, Senator Sanders had the habit of relying on a set of responses that he had in memory rather than answer individual questions with individual answers. His response fell empty. I think Senator Sanders only needed to ask, who would want an inferior plan no matter how much negotiations went into getting it? The Sanders plan was better, but he didn't effectively address the Biden statement. I could say that Joe Biden traded universal health care for the presidency, but that would be unkind and argumentative. However, it was the end of public discussion on universal health care, and it was really the end of the Senator Sanders presidential run. I had the answer for that moment then, and I have it today. In essence, it is to let universal health care be voluntary. As you know, single-payer, government-sponsored universal health care is the choice of most every developed nation in the world except the United States. We have a for-profit system. We pay twice as much for our health care as other countries, and we pay about twice as much for the same prescriptions, sometimes by the same manufacturer. So, we can make improvements to get closer in cost and care to what other nations enjoy. Here is my plan. First, I'd like to establish a department in government similar to that of the post office. As you know, the post office is an offshoot of the executive branch of government. In this separate branch, I would offer health care as a single-payer, full-coverage insurance plan to anyone who wanted it. I would guarantee each person or family that the cost of them would be at least 20% lower and perhaps as much as 50% lower than what they're paying now. The 50% figure comes from some estimates and studies published over the years. Either way, it would be a great improvement to get health care coverage with no deductions and no copays. With inflation and the value of money changing rapidly, and the internet becoming increasingly unreliable as an information source, it's hard to look at dollar-to-dollar comparisons. But when the total public outlay for health care premiums was $4.5 trillion annually, the Congressional Budget Office reported that universal health care would have saved $650 billion. That is about a 13% savings. So we know we're close. Few Americans would refuse a better health care plan at a 13% discount. With some minor changes, I think a 20% reduction is quite achievable. Another goal would be to work toward capping employee deductions at 5% and employer contributions at 5%. We would only be making modest changes in the industry to try this approach. After all, it works in 23 other developed nations. Why can't we get it to work in the United States of America? Success for my plan rests on people signing up. I think individuals and families looking at their current costs and coverages and comparing it to a superior product at a lower cost would make the choice for themselves and their families. I think most people would choose this plan. It fulfills the hopes of those wanting universal health care, and it protects those people that Joe Biden spoke of who would like to maintain their current policy for whatever reason. And it would also protect those who do not want to pay for any health care insurance if they don't want to. They would simply be uninsured and they would be responsible for the charges they incur, just as they are now. I don't think of this as a social program or socialism, and I'm not afraid of a capitalist solution. If anyone has a better plan that would save the same amount of money and provide equal or better coverage, everyone would be interested in hearing about it. I think my plan is one worth being in that conversation. If you like this plan, or even if you don't, I'd like for you to share it so others can begin a conversation on issues that matter to rank and file citizens like you and me. Even if you already have chosen another candidate, every person should have access to information about proposals of the various candidates, and everyone should have a choice. I would, by the way, like to be your choice. I would bring steady leadership and informed thinking to the office. Thank you very much. This has been Jim Davis.